Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalized support for every client. Thirdly, we have a proven track record in successful installations. Globe Care Hospital in Eastleigh, we delivered and installed an X-ray machine. Lydia Key Memorial Hospital, we delivered and installed an X-ray machine and a computed radiography machine. In Calvary Hill Hospital, we delivered and installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Center. Jabs Medical Center. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalized support for every client. Thirdly, we have a proven track record in successful installations.
So, welcome our viewers to Medwise TV this afternoon. In Medwise TV, we aim to inspire, educate, and inform. In our show today, we have a special guest, a senior radiographer, a member of the Society of Radiography Kenya, SORK, Council, and to be specific, a representative of radiographers working in public service, national government, in the SORK Council. He's a dedicated senior radiographer who has worked with a lot of experience spanning many years in the radiography profession. So in Medicwise TV, we believe we are the haven of healthcare conversations, and we will keep informing you and bringing you such kind of guests in future. So before we start the show, we will wish to welcome you with your views through our WhatsApp number 076-9-211-995. You can send your texts your questions, your suggestions, and above all, your motivation to our team through that WhatsApp number. You will be seeing it on your screen. Please don't fail to interact with us. So, straight to the discussion, we welcome our guest, Mr. David.
Thank you, host.
Welcome, David.
I'm happy to be here and to be hosted in this Medicwise TV show. I'm proud to be interviewed in this platform. As I have been introduced, I'm a radiographer, a senior member in the field, having worked in the field for close to 20 years now, and above all, representing radiographers working for national government within the Society of Radiography in Kenya. So thank you, host, and I'm glad to be here to interact with our members.
So David, as a SORK member and representing radiographers working in public service, can you elaborate briefly what is your role in SORK Council?
Thank you, host, and that's a very good question. Many members might not know the society in terms of representation. Due to the advent of Radiographers Board of Kenya, which is yet to be constituted, the society looked at the structure to align it with the Radiographers Act 2022, basically to align with the Act, and that's how we came up with the SORK chapters, so that we can have different representation. And we have like 5 chapters represented, and I will talk basically on the chapter I represent, radiographers working within the national government level. And basically what I'm supposed to do is to ensure all radiographers working on national level are represented within the society, and their voice can be heard. So I will talk about 4 basic things which I'm supposed to represent the members on. And the biggest one is professional advocacy and representation. I will talk about policy development and standardization. I will talk about continuous professional development, and the last one, I will talk about strategic leadership within the Society of Radiography in Kenya. So basically, I will expound on the first one, which is professional advocacy and representation of radiographers working in national government. As you know, we cannot sit, all of us, within the national body, that is the Society of Radiography in Kenya. So members can be represented by one member who can articulate their needs and their welfare within the national level. So in terms of advocacy, is acting as a voice for the members who are working in the national level. Another one is to deal with policy development and standardization. As you know, we work in a field where medical field like radiography is dynamic. So you have to ensure that members are well represented in terms of policy which come up. Their views can be heard, and the members are able to feel they are represented within the policy we develop.
Maybe before you continue,
yes,
it's good to also elaborate and
Yes.
bring forth the understanding. How does council achieve those 4 or 3 pillars you have talked about?
Yes.
How does council organize itself so that to make sure it achieves those objectives towards the members serving in the national government?
Thank you for the question and the interjection. And I can say the society, being the voice of all radiographers working in Kenya, time and time again, the body represents members in government issues. And you know, as I said, we cannot all work in the Ministry of Health and start representing us all. But the society will develop policies which it can share with the government and which can inform the decisions which the government might need to improve on in terms of radiography matters in Kenya.
Let us take, for example,
Yes.
Welfare
Yes.
of members working in the national government
Yes.
as radiographers.
Yes.
One issue could be, for example, articulating for their maybe their benefits in
Yes.
terms of salary increment.
Yes.
Does SORK ask that voice to talk to maybe the counties or to lobby for them so that they can get a pay hike or packages which are aimed at improving their welfare and performance?
That's a good question. And I would like to first put a disclaimer that the Society of Radiography in Kenya, being a professional body, has a voice in terms of advocating for members' welfare. And I hope members have seen us in so many platforms fighting for their rights. And we do this in collaboration with other professional bodies in the field to ensure that our members' voice is heard within the national level. And I can say that in absence of operational radiographers body, or Radiographers Act 2022, the society has stepped in the gap to ensure that radiographers are not left out, and we go there, out there, to ensure that our members' voice is heard. In national platforms, the government has actually recognized the society, and we are able to articulate for members' welfare in any opportunity which arises within the national sphere. Thank you.
Thank you so much. As we continue this discussion,
Yes.
It is important also to bring out which institutions
Yes.
are collaborating with SORK with the aim of achieving these kind of objectives to its members.
Yeah.
It's good to mention
Yes.
these institutions.
As I've alluded, is that the radiographers body, that is SORK, we work with other professional bodies. As I can tell you that if you walk outside there and you try to advocate for only radiographers matters, the government might not hear you. But we have a collaborations with other professional bodies like nursing union, clinical officers union, and many other professional bodies which advocate for their members. So we join forces. As you know, numbers matters. So that's how we as the society has put ourselves to collaborate with other members, so that when the views for other professionals, health professionals, are articulated, we are able to also push for the radiographers' welfare within those platforms.
You have mentioned the chapters.
Yes.
That there are different chapters which were introduced by the Society of Radiography in Kenya.
Yes.
In which you represent one of the chapters.
Yes.
Which is the national, the radiographers serving in the public service.
in national level.
Are you able to tell the members what is the statistics in terms of the number of radiographers serving in the public service in Kenya?
Thank you for the good question, and I will start by elaborating the challenges we have in Kenya, and particularly in our profession, is that we have seen an apathy in terms of membership to the society, and we continue to advocate members to belong to the society. And I can articulate and say we cannot, and we don't have a specific data on how many radiographers are working in the national level. But at the moment we are working on clear data, because we are pushing for all members to be represented, to be part of the professional body. But I can put a figure of around 200 to 300 members who are working within the national level. But we believe there are more than that. But we are pushing members to be aware that belonging to a professional body.
Do we say the members working in county hospitals, are they classified among the members working in the public service?
That's a good question. I can say no, because in the chapters we have a county radiographer, a council member representing radiographers working in county level. So maybe I can mention the other chapters so that you can know which person belongs where. We have radiographers working in national government being represented.
Okay.
Radiographers working in private practice, in private hospitals. Radiographers working in county level, like counties. They have representation. We have radiographers working in forensic. We have a representation. We have radiographers working in the industry.
Industrial
radiographers, yes. So those are some of the chapters we have. So national and county radiographers are not classified in the same chapter.
Okay, they are not in the same chapter.
They are not in the same chapter.
Okay. Maybe you can highlight to the members.
Yes.
Because we are talking of statistics.
Yes.
Maybe there is an exact number in the Office of Society of Radiography or an estimate of now, currently in Kenya, how many radiographers are practicing?
As I said, we have very limited data as we speak, and we continue to advocate for members to come and register with the society. Currently, if you look at our website, we have about 1,400 registered members who are practicing. But as a society, we have our background information that we have close to 5,000 members who are working and who are trained and practicing radiography in Kenya. But we continue to ask, especially the young radiographers out there, who are continuing
of the of the 5,000 members estimated.
Yes.
Total number of radiographers practicing in this country, Kenya.
Yes.
So how many in your voice as a council?
Yes.
How many of these are fully registered and up-to-date members in the data of Society of Radiography in Kenya?
The ones who are registered and up to date?
Yes, yes.
As I said, we have close to 1,400 to 1,500, even up to 2,000. But we are working on data.
That shows, if it is 1,400, that shows there are quite a number. The majority of radiographers are not members of the society.
Yes.
And like you mentioned earlier, there is apathy in terms of registration.
Yes.
So what is the strategy? What kind of strategy is council making to make sure that these members who are not registered come on board?
A good question, and I can say as a society we have not stopped advocating for members to join the society. One of the big questions we get from members is, especially the young members, is that what are the benefits do I get when I register as a member? We continue to advocate that when you belong to a society, you belong to a family. And if you have challenges outside there, you have a family to look after. But if you are alone practicing outside there, if you get challenges, you are likely to suffer more. So it's good to belong to the society. But as a society, what we have been doing is that we are moving from county to county, ensuring that members continue to register and continue to be members of the society. And maybe for long term.
Let's stick there. Let's stick there on moving from county to county.
Yes.
Is this why you made the decision as SORK Council that the AGM, annual general meeting, should be devolved?
Yes.
Is this one of the benefits?
Yeah, that is one of the ways of ensuring members can be met even at their point of practice. And that's why we decided to devolve our AGM so that we can be doing it rotational, and we are able to, you see members when they come to Nairobi all the time, they complain you don't come to our place. So we have strategically placed AGMs to be rotational so that we are able to meet our members out there, and we also continue to advocate for them to be part of the membership. And maybe I can add this. Another strategy we are using as a society, we have ensured that our students right from the college know the benefits of belonging to the society. And we have worked with the training institution, and we are ensuring that our young radiographers, the future of the society, members are able to register from college level, and we are able to receive that data, and we can do follow-up and mentorship for the young radiographers, because we believe the society belongs to the young people.
Tell us about the AGM. I understand it's happening in less than 1 week from now.
Yes.
Tell us the preparations and who is attending, and maybe those who have not made a mind to attend, you can be able to give them a reason why they need to attend.
Thank you, host, for the good question. What I would like to say is that the AGM is coming on 14th of March 2026 in Nakuru. Probably members, those who are fully paid up members are eligible to attend. You can check whether you are eligible to attend in our SORK website, because we have shared all the information for members who are up to date in terms of monthly contribution to the society. But in future, we want to have as much members as possible.
Are you saying basically anyone who is not a member of SORK, even if he is within Nakuru town, should not walk or come nearby the venue of this kind of meeting?
I think that's a good question, and I can ask you, I can answer this by telling you that you can only attend a party which you are part of it. So if you are not a member of the society, you are not a fully paid member, we are not locking out. But because we have a constitution which we need to follow, members who are fully paid will only be the one eligible to attend. And that's why we are sending all the information out there for members who are eligible to attend. So right now, as a council member, I'm only allowed to encourage members who are fully paid to attend the AGM. Thank you.
And I understand the AGM will have a pre-AGM workshop.
Yes.
Maybe you can brief members what about this workshop and who is supposed to benefit from this kind of workshop.
Thank you. As I said, that the society endeavors to ensure that members are up to date in the current continuous medical education. So the society saw it necessary, instead of having just an AGM where people will come and sit and chat and deliberate, we felt like members, if we have a pre-conference, whereby members will have a CME on certain topics like MSK, we are going to add value to the membership in terms of knowledge. And actually, those are some of the benefits I talked about in terms of members who ask what are the benefits.
Do you have experts who are presenting in the workshop? If any is good to mention to members? Mm-hmm. And how is it organized generally?
I can say that we have talked to very senior colleagues in the field in terms of that kind of workshop we are going to have. And I can say that maybe almost 95% is our own members who will be doing the CME presentation. And of course, we have brought in our colleagues in the field who are the radiologists. So we have a radiologist coming in, and radiographers who are specialists in the same field coming in to showcase also their skills in that pre-conference. So I don't want to mention the names. I don't want to preempt the people we have invited, but just be sure that we have invited one of the best colleagues and members of the radiology profession to come and talk to members. So members are encouraged to attend this pre-conference workshop, which will be happening on the 13th. That is on a Friday before the AGM. So all members who are registered can attend.
There has been a debate on social media.
Yes.
On the social handles of the Society of Radiography.
Yes.
Concerning the council members' delayed reports, reports are not arriving on time.
Yes.
And some members were of the view that this is against the Constitution and it is not warranted. Is there a disconnect in terms of how the council is working? Do you think the council is working harmoniously, and members have a concern why the reports, especially the treasurer report, could delay? What is your opinion, because you sit in the council, on this issue, because it has been very emotive on the social handles of SORK?
Thank you for the question. And being part of the council is a difficult question to ask, but I believe we have a constitutional mandate to adhere to. And I saw the kind of it has generated for the reports to come late. But I can say that 90% of the reports were sent on time. But I'm not going to dwell much on the reports which came late. But I can attest that the Office of the Treasurer has been having some challenges in terms of the accounting part. Accounting means that we have an external professional who does the society accounts. And basically, the treasurer has to use some of the information which are generated by the accounts. And out of the challenge we have with the society accountant, who is an external official in the council, the SORK council has endeavored to, one, to ensure that the accountant works within the times which he has been given. So I can attribute much of the challenge which has come out with the treasurer's report from the delays in the external official, who is the accountant of the society. And the society and the council has taken measures which I think will be presented within the AGM on the measure in terms of ensuring that we get the right professional to do our accounts. So basically, I believe...
You personally,
yes,
in your opinion,
yes,
can you say the council is working harmoniously?
Without fear of any repercussion, I can say for the last 1 or 2 years, I think this is our second year, I can say we have been working very well. And the challenges which have been there...
Point of correction.
Yes.
You in the last AGM,
yes,
I remember you brought a motion on the floor of the AGM,
yes, with
an intention to impeach or interdict the honorable secretary to the council.
yes,
and you work in the same office.
mm-hmm.
So as a member of the council, working with the same council, you bringing a motion to remove one of the members of the council did not portray well to the members that there is harmony at work. Maybe you can clarify to members why you did that and what was the motive.
Thank you for the question, and I wish to answer this candidly and say that when you are working somewhere, I think there are rules and regulations which have to be followed to the letter. I believe that my AOB, which I brought in the last AGM, was portrayed to look like I was witch-hunting somebody within the council. But basically, I think my motion was wrongly interpreted by even very senior members of the society.
What was the intention of the motion?
I want to answer you,
You tabled in the floor of the House.
Yes.
You wanted a member of the council to be removed from his office.
So what
was the intention?
I wanted to answer you. So I was in the process of answering you candidly that when we joined the society, we were supposed to follow the Constitution. The Society of Radiography.
Are you saying someone did not follow the Constitution?
I'm coming there, sir.
Okay.
Yeah, so when I brought that motion, I saw a gap in that office. And I can say that if you look at the SORK Constitution, the preamble of the SORK Constitution in terms of interpretation of the Constitution, it talks about how a temporary vacancy can arise within the society for the council members, whether the president, whether the secretary, whether the treasurer or the council members. And this can arise when somebody is predisposed in terms of illness. If a member is insane, is not in the right mind.
What was happening in this case? In this case, what was happening with the members? The member you were...
I'm coming there. I want to talk about
for the purpose of time.
Yes, for purpose of time.
Move faster.
Yeah.
What was happening in the member in this case?
I believe...
What did you see as a weakness in
the Constitution?
Yes.
In the breach of Constitution, I believe there was... and even now, as I speak to this interview, I still believe there is a temporary vacancy which arose in the office of the Secretary General.
So given chance, even now you can table the same motion. If you believe it can pass.
I will table the same motion, and because members did not take time to read my motion, and they referred it to the disciplinary committee within the society. I will leave that matter to that, but I will tell members to go and read on interpretation of the SORK constitution when a temporary vacancy arises.
Maybe tell us, after
Yes.
the members referred that to the disciplinary committee,
Yes.
what is the verdict so far of the disciplinary committee? What did the disciplinary committee conclude on this issue?
I want to say this. When this matter was referred to the disciplinary committee, there was still a vacancy in that committee. There was no committee in place. And that's why members were asking me, why did you take the issue to the AGM? Why did you not follow the disciplinary committee? There was no disciplinary committee in place. And that's why I didn't pass the motion through the disciplinary committee. But now, when the AGM directed that we form a disciplinary committee, the council has done that, and I think they are working up the matter and maybe to listen to the matter. So
the
for
matter
now,
is being dealt with the council?
by the disciplinary committee, not the
Okay.
council. Yeah, thank you. Which is a disciplinary committee is within the constitution of SORK.
I understand also
Yes.
this year, the Society of Radiography in Kenya is preparing for the biannual scientific conference.
Yes.
Maybe you can tell members when will this happen, and what do they expect, and what are the plans towards achieving a successive scientific conference?
Yes. I take this opportunity also to encourage members to be part of the scientific event, which is coming in September this year, 2026. It's usually a biannual event, and this one, all members can attend, whether you are registered or not. It's a professional discussion, scientific discussion. So we are having the event in September 2026 in Kisumu City, and we are encouraging all members to attend. All the plans are ongoing. We have all committees set, and we are at the right track in terms of achieving the event in this year after the AGM, which is in September. So members, I think they have been informed in various platforms, the society's platform, and they continue to be reminded on the same. Thank you.
So you have not told them when this, when is this scientific conference happening?
I said in September.
Okay, September.
Yes,
Are
September
the dates
2026.
decided already?
The dates are there, and the posters are out as well.
Okay.
Yes.
So we are looking forward to a big scientific conference. Where is the venue?
I've said the venue will be in Kisumu City, and it's an international event. So members can come and interact and network with the peer members who we have invited from international, even international side.
Okay.
Thank you.
So we are very appreciative to have you in this sit down in this interview. We don't take that for granted, Mr. David Muli.
Yeah, thank you.
Representative of the national government working radiographers in this country, in the SORK Council, a very dedicated and committed radiographer in this country. And we look forward to bringing you this kind of conversation and this kind of guests in our future discussions. Maybe I give you more time, maybe 1 minute, to give you a parting shot to the members of the Society of Radiography and healthcare professionals in the country widely, because in this Medicwise TV, we don't only deal with radiographers, we look forward to dealing with all cadres of professional entities in this country and other professionals from other medical fields. So what is your parting shot?
Thank you for host for such a platform, and I wish to congratulate you, Medwise TV, and I know you have been a champion of radiographers' growth in our country. You have ensured our members get affordable equipment in the field, and I'm happy to be associated with this platform. So for members who are SORK members and even those who are not SORK members, kindly let's work as a team. The field is wide, and we are the labelers, and we can make an impact in the health if we do the right thing at the right time. So thank you, and I wish to interact you more. And let's all come to our AGM, those who are registered members, and those who are not registered members. We continue to call upon you that being in a professional body, you belong to a family. When you are outside there alone, there are many challenges which we see, and we can help you better when you belong to the Society of Radiography in Kenya. Thank you.
Thank you very much, members, for joining in this conversation, and we are very glad to have you. In order to support us as Medicwise TV, we urge you to subscribe, touch that subscribe button so that you become our fan. We have arranged for you in the upcoming week, members, senior members of the SORK Council will be coming here. It will culminate with the president of the Society of Radiography Kenya will be here to talk about this conversation. And we are happy to bring you this kind of conversation from Medicwise TV. And as your host, my name is Didakus Mochache, aka Dida the X-Ray Man. And remember, this show is sponsored by RadMed Connect Limited, a supplier of medical devices, to be more particularly X-ray and ultrasound. So if you have clients who are willing to support us in purchase of ultrasound and X-ray services, we will be right here in RadMed to supply you. Thank you so much, and thank you so much, Mr. David.
Thank you.
Muli Muonga. Is it Muonga or
Muonga?
Muonga.
MWNGA.
Keep in touch. Thank you so much.
Thank you.
Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines. We have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalized support for every client. Thirdly, we have a proven track record in successful installations. Globe Care Hospital in Eastleigh, we delivered and installed an X-ray machine. Lydia Key Memorial Hospital, we delivered and installed an X-ray machine and a computed radiography machine. In Calvary Hill Hospital, we delivered and installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Center. Jabs Medical Centre. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalised support for every client. Thirdly, we have a proven track record in success.